Okay guys, we might make a start now. You have to forgive me if I have any issues with the Collaborate, but I'm sure you'll help me out. My name is Dr. Tegan Pomona. I'm filling in today for Fiona. We're going to be talking about the spinal cord. I believe that you've just been doing some lectures on the brain, so this sort of follows on from that. Just give me a yell if you can't hear me, or if you can't see something, and we'll try and work it out. So a bit of an overview of what we'll be talking about today is, first we're going to have a look at the spinal cord anatomy. We'll start with the gross anatomy, and then we'll be looking a bit closer at the spinal cord. We'll have a brief look at some of the spinal cord trauma and disorders before moving on to neuronal pathways and developmental aspects of the central nervous system. Okay, we'll start with the gross structure of the spinal cord. As you can see, it resembles the spine, and that's for a pretty good reason, because we have a matching pair of spinal nerves for every vertebra of the spinal cord. The only place where that's not the case is in, I'll get my pointer. Sorry. That one. Okay, so the only place that's not the case is the cervical spinal nerves, because there are actually 8 pairs of cervical spinal nerves that go with the cervical vertebra. You can also see here we've got 2 areas of enlargement, and we've got the cervical enlargement here and the lumbar enlargement a bit further down, and that's because that's where all the nerves will travel out to our arms and our legs. So there's a lot more nerves to supply the skin and muscles of the extremities, so we therefore have a bit of an enlargement in these areas to encompass all those nerves. Okay. I guess something else to note in this picture is that the spinal cord does not run the full length of the spine. It actually terminates here at the conus medullaris, and it's called that because it actually, in the cadavers, we'll have a look at some pictures a bit later, but it actually looks like a cone. So that's where the actual spinal cord terminates. You can see that there's still quite a number of spinal nerves that are supplied below the termination of the spinal cord, and so these all come out of that conus medullaris, and they actually look like a horse's tail. So they're called the cauda equina, which translates pretty much to tail of the horse. And again, we'll see that better in some of the pictures in a minute. Okay, so yeah, basically the 31 pairs of spinal nerves, all matching with the vertebra. So that's basically what we need to know from the gross anatomy. Okay, so this is a picture from a cadaver, and this is the cervical region of the spinal cord, and you can see that bit of an enlargement in the spinal cord here. You can see the spinal nerves coming out of the spinal cord, and up the top here. So the spinal cord exits the brain through the foramen magnum, which is basically a big hole in the skull. And it's, what else have I got here? Yeah, so it's starting at the end of the medulla oblongata, which you would have learnt about when you were looking at the brain. We've also got in this picture the dorsal median sulcus. Sulcus basically just means crevice, and this crevice runs all the way along the spinal cord. So you can sort of see it in this picture where it's just a bit of a line running up and down the spinal cord. So again, we've got the next section down, the thoracic region of the spinal cord. What this image shows really nicely is this dorsal root ganglion. We'll look at that in some of the cross sections of the spinal cord. But that's sort of an important structure that you will need to remember. And the dura mater, we'll go through the protective layers of the spinal cord as well. And the dura mater is the outermost layer of the spinal cord. Okay, finally the end of the spinal cord. So this is the cone that I was talking about, the cone shape. And as you can see, all these spinal nerves coming off, they do look a bit like a horse's tail. Oh, we've also got this filum terminale. And so basically it's a really strong filament that anchors the spinal cord to the coccyx to basically hold everything into place. Okay, so we've got the two lengthwise grooves that run the length of the cord and partially divide it into right and left sections. Pretty much all of the spinal cord is symmetrical, so this divide shows where the symmetry begins. I pointed out the median sulcus on some of those cadaver images before. There's also a matching fissure on the other side, and we'll see that better in some of our cross sections. Grey matter is in the core of the spinal cord and white matter on the outside, and it takes a really distinctive shape throughout the length of the spinal cord. And finally, right in the middle of the spinal cord is a canal, and it's filled with cerebrospinal fluid, which we'll talk about the function of cerebrospinal fluid a little bit later. Okay, so this is the cross-section that we will, I guess this is probably the most important structures that you need to know in the spinal cord. You can see here that fissure that we were just talking about, and the one on the back, the dorsal median sulcus, is not quite as obvious, but it's still there. I think it's better in the next picture too. I guess I'll use this diagram to talk about the layers protecting the spinal cord. So these layers are called the spinal meninges, and they're all, so we've got the dura mater, arachnoid mater, and the pia mater. Mater translates roughly to mother or protector. So you can sort of, I find it easier to remember if you sort of know what these words mean. So obviously these layers are protecting the spinal cord. So we'll start with the dura mater. Dura means hard, so this is the hard outside protective layer that basically encompasses the whole spinal cord. Beneath that we have the arachnoid mater. Arachnoid, as I'm guessing you might know, translates to spider, and this layer is really web-like, so it's a web-like covering. It's the layer beneath the dura mater. And then finally we have the pia mater, which is the soft layer. So that's the final layer of protection before we actually reach the spinal cord. This layer is really important because it has the blood vessels that supply blood to the spinal cord. Okay, between each of these layers we have spaces, and these spaces have pretty important clinical applications. So firstly, probably the one that most people would be most familiar with is the epidural space, and this is the space outside of the dura mater and between the vertebrae. As you can see in this picture, it does contain fat, so that's the fatty layer there, and on the other side, just here. And this fat acts as a bit of a cushion, a bit of shock absorption. So it really has that purpose of protecting everything that's inside of it. You'd also be familiar with the term epidural because obviously it's probably one of the most common forms of pain relief used during childbirth. So in order to deliver an epidural, an anaesthetic drug is delivered into this space, which then has the function of numbing the spinal nerves that exit out through here. So as well as then preventing pain messages from being received, it also reduces the motor capacity that the anywhere below the point of epidural. Yeah, so basically you have limited movement anywhere below where the epidural is delivered. Okay, so the next space that we have is this subdural space. Not as much clinical applications, but it is important because it's a space that we can use if there's been a bleed in the brain, it will bleed into the subdural space. So yeah, we can diagnose that from there. Finally, we have the subarachnoid space. So this is below that sort of spiderweb layer, and this space is important because it contains the cerebrospinal fluid. So cerebrospinal fluid is fluid that surrounds the spinal cord and the brain, and it carries the dissolved gases and nutrients and also wastes, and also provides insulation and shock absorption. So we've got these multiple layers of protection that are providing this shock absorption to prevent any damage to the spinal cord because it is so important. So I guess this is also the space that's used for a spinal tap or a lumbar puncture. So basically a needle is inserted in between the fourth and fifth lumbar, and you can draw the cerebrospinal fluid out from this subarachnoid space. Can be used to diagnose quite a few different things, infections, like meningitis. Yeah, so it's quite commonly used in when they're trying to diagnose issues with babies. Okay, so this diagram really nicely shows those three layers. We've got the dura mater down the bottom, so you can see that it looks hard and strong. The arachnoid, which looks that web-like, and then the pia mater with the blood vessels. What you can also start to see in this picture is this really distinctive shape of the grey matter within the spinal cord. Some people think it looks a bit like a butterfly or a H, but I guess if you're thinking of it as a butterfly, instead of calling these wings, we call them horns. So you have your dorsal horns at the back and your ventral horns at the front. In some areas of the spine, not all, you also have these lateral horns, just going out to the sides. We saw before the dorsal root ganglion in one of the pictures in cadaver, so that's represented in this diagram here. I think we'll go through these a bit later. And yeah, so then we've got the two roots of the spinal cord coming out to form the spinal nerve here. Going to that in a little bit more detail. So as I said, the cross-section resembles a butterfly or the letter H. Now it's not consistently the same shape throughout the spinal cord, so there is quite a bit of variation depending on the purpose at that point in the spinal cord. And as I said, we've got the dorsal horns. Now the important thing to remember here is that the dorsal are your sensory horns, and the ventral horns are our somatic or motor neurons. So basically anything to do with sensory is coming in through the back of the spinal cord, and anything that's motor is going out through the front of the spinal cord. And as I said before, the lateral horns, they're only in the thoracic and superior lumbar, and these are your sympathetic neurons. So within that H shape, the middle of the H is what we call a great commissure, and this bridge enables that communication from side to side of the spinal cord, and it encloses the central canal, which has that cerebrospinal fluid running through it. I guess this is kind of important, these terms. You need to remember these ones for all of the anatomy that we'll be doing of the spinal cord. So we've got our ventral roots, which are those, what I said before, the motor, because they're on the ventral, and dorsal sensory. We saw in the little picture before that there is a dorsal root ganglion. The cell bodies of the dorsal neurons are actually within this ganglia, whereas for the motor neurons, the cell bodies are in the grey matter of the ventral horn. I'm sorry, the two roots will exit the spinal cord and join together to form the spinal nerve. So we can divide those, now that we've divided the spinal cord basically into sensory and motor, we can divide it further into somatic sensory, visceral sensory, visceral motor, and somatic motor. We've got a nice little diagram. Oopsies. Now these visceral motor neurons are going to make up the autonomic nervous system. Look at them in this picture. Okay, so we can see again, as I was saying before, we've got the motor neurons at the front, sensory neurons at the back. You can see that nice H shape of the grey matter clearly in these diagrams. And we've got everything symmetrical on either side of these two of the fissure and the sulcus. As I mentioned before, we've got the dorsal root ganglion. Ganglion basically means cell bodies outside of the central nervous system. So that's where our cell bodies are for the sensory neurons. And as we mentioned before, the point where these two roots fuse is it becomes the spinal nerve. And this is obviously the same on both sides, and then we end up with 31 pairs of these running down the spinal cord. So basically I guess that's what we need to know when we're talking about the grey matter. Really importantly that the structure is maintained throughout, with the sensory neurons at the back and the motor neurons at the front. So I guess in saying that also, because the sensory neurons at the back, that means that information will be travelling to the spinal cord from the dorsal roots, and away from the spinal cord because it's carrying that motor information in the ventral roots. Okay, so now we'll move on to the white matter. So obviously if you've got this grey matter H shape in the middle. Around it we have this white matter. It's white because a lot of the fibres in this area are myelinated. And the main function of white matter is to allow communication between parts of the spinal cord and the spinal cord and the brain. So this communication will run in 3 directions. Ascending, obviously, for those sensory inputs, so taking information to the brain. Descending, taking those motor signals away from the brain. And transverse, from one side to the other, because we need to have communication from both sides of our bodies throughout the spinal cord. Again, the white matter can be divided into columns, and we've got the dorsal, lateral, and ventral. I think we've got a picture of that. On 31 pairs of spinal nerves. So they, matching with the vertebra, except for in the cervical region where there's 1 extra pair. Okay. So within these, I guess these columns can also be called the tracts of the white matter, and they're composed of bundles with similar functions. Okay, so you can see it in this diagram here that we looked at before. We've got the dorsal funiculus, the ventral, and the lateral. Within these, there's several different tracts, all serving different purposes. Okay, here's a good diagram showing those tracts. So in the blue, we have the ascending tracts. So these are all sensory tracts, carrying sensory information to the brain. And in the red, we have the descending tracts, carrying the motor information away from the brain. We will go through the main neuronal pathways that are occurring in these different tracts. So for the ascending, we've got the 3 main ones: the dorsal tract, the spinocerebellar tract, and spinothalamic tract. We won't go through all of the descending ones, but before we get to that, we'll just look at some of the clinical, some of the trauma and disorders. So obviously, damage to the spinal cord is, pretty terrible. And there's lots of different ways that the spinal cord can be damaged. As we said before, those dorsal roots carry all that sensory information. So obviously, if you had some damage to the posterior of the spinal cord, then we're going to have sensory function loss. So this is paresthesias. Then we've got paralysis, which is damage to the ventral roots or the ventral horns of the spinal cord, leading to motor function loss. There are 2 types of paralysis: flaccid or spastic. So flaccid, obviously, like it sounds, there is no voluntary control of muscles, and there's also no involuntary control. So basically, there's no movement whatsoever from if it's flaccid paralysis. Eventually, you'll have muscular atrophy resulting from this. The second type of paralysis is spastic paralysis, and this can result in uncontrolled movement of the muscles. So the neurons remain intact, but the muscles can be stimulated by reflex activity, but they can't be stimulated by voluntary control. Okay, so then we've got transectioning. So this is complete damage to the spinal cord, both the dorsal horns and the ventral horns, and it results in complete motor and sensory loss in areas in areas inferior to the cut. So then we've got paraplegia and quadriplegia, which I'm sure you're familiar with. You can also have spinal shock, which is sort of a temporary damage to the spinal cord, and it usually the function returns. Maybe not to a full extent, but the majority of function returns. Okay, another one that we've got is poliomyelitis. The poliovirus can cause damage to the ventral horns of the spinal cord, so therefore damaging those motor neurons. So death may occur from poliomyelitis because of paralysis of the respiratory and cardiac systems. So yeah, without muscular control over these systems, then death is going to be pretty rapid. And finally, we've got Lou Gehrig's disease, which is, again, destruction of the ventral horn and the fibers of the pyramidal tract. We will be looking at those in the pyramidal tract in our neuronal pathways in the next section. But the symptoms of Lou Gehrig's are loss of ability to speak, swallow, and breathe. And you can see death typically occurs within 5 years. So yeah, the only treatment for this is the use of the drug riluzole, and this interferes with the glutamate signaling. Okay, so we'll move on to the neuronal pathways. Couple of terms there for you to become familiar with. Decussation is crossing from one side of the central nervous system to the other. A relay is a chain of 2 or 3 neurons. Somatotopy is the spatial relationships, and symmetry. As I mentioned before, we've got this symmetry reflected right throughout the spinal cord and as well in our neuronal pathways. So the first ones that we're going to, I'll just have a look at this diagram again. We're going to talk about the ascending tracts first. So those ones in the blue. And as I mentioned before, these are all sensory because they're going to the brain. Okay, so with all of our ascending pathways, they're conducted upwards through a chain of 3 neurons. Some of them have only have 2, but I'll talk about those in a minute. So the first order neurons, they're pretty simple. So they're from your effector, or your receptor to the second order neuron. So this is basically the first link in the chain of the ascending pathway. And it synapses with the second order neuron in one of 2 places. The first place that it synapses would be in the dorsal root ganglion, or in the dorsal horn, or in the medulla. So the second order neurons, we've got the cell body either in that dorsal horn of the spinal cord or the medulla nuclei. From there, the second order neuron axons extend into the thalamus or the cerebellum. So if the second order neurons extend into the cerebellum, there are no third order neurons. So, however, if they're in the thalamus, we do have these third order neurons. The medulla. Oh, sorry, we've got this, so the second ones can go into the cerebellum as well. If they're going to the cerebellum, then there's no third order ones. Okay, so we've got 3 main pathways for these ascending tracks. As I said, we've got the one that ends in the cerebellum, so that's only got the two neuron pathways, and these two have the three links in the chain. So we've got the dorsal column medial lemniscal pathways. That was in our diagram before. So the dorsal column, they'll be travelling up through the back of the spinal cord. Spinothalamic pathways. And, sorry, I think we've got more on these. Yeah, here we go. So the dorsal pathways will transmit somatosensory information. So this is the fine touch and vibrations information, not your coarse touch, so just more specific information. We've got paired fasciculus cuneatus and gracilis in the spinal cord. So in that diagram before, that's these two here, fasciculus gracilis and fasciculus cuneatus. So that's basically where these tracks will be travelling through the spinal cord. We've also got the spinothalamic pathway. I guess a bit of a tip, anything with spino at the start means sensory. So when you see that, you know that it's referring to an ascending pathway. We've got lateral and ventral spinothalamic tracts, and these transmit pain, temperature, coarse touch, pressure, impulses. It's not all within the lateral, but yeah, so within the lateral and ventral spinothalamic, so all of these things are transmitted. Finally, we've got the spinocerebellar pathway, and this transmits information from proprioceptors, so information about the position of our joints and muscles to the brain. And this helps us to coordinate muscle activity. Okay, so these ones get a little bit complex. So these are those multi-neuron pathways that we were just talking about. We'll start with the dorsal column pathway. So in this one, we've got the first order sensory neuron. We've got a touch receptor in the foot here, and that travels into the dorsal root ganglion of the spinal cord, and then into the dorsal horn of the grey matter. So it then travels up the spinal cord through those fasciculus that we looked at before. So this is still the first order, and then it gets to the medulla, where it then becomes it synapses with the second order neuron, before travelling up to the thalamus. I think we've got the same thing for the proprioceptor here in the hand, so transmitting that information about the position of the joints and muscles in the hand through the same pathway, through the dorsal root ganglion, dorsal horn, up into the medulla, where it synapses. On the other side here in the light blue, we've got the spinocerebellar pathway. So for this one, the first order neuron has cell bodies in the dorsal root ganglion, and then it synapses with the second order neuron in the dorsal horn of the spinal cord. So travelling up from the dorsal horn up to the cerebellum in this case is that second order neuron. Okay, so finally, this is the third pathway, the spinothalamic pathway. And this one, so as I said before, temperature, pain, transmitted through this pathway. And same pretty much as the other ones that we were looking at, but with all three of the neurons. So we've got the cell bodies once again in the dorsal root ganglion, synapsing with the second order neuron in the dorsal horn of the spinal cord. Then travelling up, so this one doesn't go through the pyramids of the medulla, and travelling up to all the way to the thalamus, where we have our third order neurons. There's a lot more detail about these pathways in this table. Basically, you can have a read through, but I'm not going to go through all of that today. Okay, so all of that was for sensory information. So the pathways for the sensory information to go from the receptors to the brain. So obviously now if we look at the descending pathways, we're talking about motor pathways to deliver efferent impulses from the brain to the spinal cord. So efferent referring to motor, whereas afferent would refer to your sensory ones. So we've only got two groups of pathways for these ones. We've got direct pathways, and these are called pyramidal tracts, and that is because they go through the pyramids of the medulla. All of the other tracts are indirect pathways. There's just two neuron links in the chain for this one. We've got upper motor neurons. So these are the first ones going from the brain down, and then lower motor neurons going from the ventral horn of the spinal cord and into the muscles of the periphery. Okay, so we've got we'll start with the direct pathway. The impulses from the pyramidal neurons pass through the pyramidal tracts, which we can have a look at hopefully on the next diagram. Okay, so this is the medulla here, and at the front these little points are called the pyramids. So basically our direct pathways all pass through this area of the medulla here. They descend directly without synapsing until they reach the end of the tract in the spinal cord. In the spinal cord, the axon synapse with the interneurons or the ventral horn motor neurons. So basically travelling all the way from the brain down through the pyramids of the medulla, and then, depending on where they're going to, into the ventral horn of the spinal cord, and that's where they'll synapse, and then we have the lower motor neurons leaving the ventral horn, going to the skeletal muscle. So these direct pathways regulate fast and fine movements. So it sort of makes sense that you want to have direct pathways for these types of movements. So we do have two pathways shown in this diagram, and they're both crossing over at different points. So what have we got here? We've got one that's crossing over just after it goes through the pyramids of the medulla. And then we've got the other one crosses over in the actual spinal cord. Okay, so next we have the indirect pathways. And these are obviously more complex and multisynaptic. There's quite a few of these that I guess are pretty much beyond the scope of our initial lecture. But the pathways that are maintained by these indirect multineuronal pathways are like balance and posture, coarse limb movements, head, neck and eye movements that follow objects in a visual field. Okay, so we've got, what have we got here? Yeah, we've got four of the major pathways: reticulospinal and vestibulospinal. This is for balance and posture. Rubrospinal controls flexor muscles, so your big movements. And tectospinal tracts. And this is the one you just mentioned with your head following visual stimuli. Okay, so we've got, because this is a motor pathway, we're starting here in the red nucleus in the midbrain, travelling down to the ventral horn where we're synapsing before travelling to the muscle. So I've only just covered one of them here, the rubrospinal one. I guess it's the most simple of those indirect pathways that we were looking at. Again, there's a bit more information about this in the slides that have been uploaded, but I think also in your textbook. So yeah, a bit beyond the scope of today. Okay, the final thing that we'll just quickly touch on today is developmental aspects of the central nervous system. Because these structures are really important, they're formed really early on in the embryo. So in a 3-week-old embryo, these three main processes take place. They take about a week to complete up to this stage of the neural tube. So first, we have a thickening of the ectoderm, and this forms the neural plate. We'll have a look at this in a picture in a minute. This then folds down to form a neural groove. Okay, so if you think of this neural plate a bit like an open book, as you shut that book, it's going to fold down into a groove, as you can see in this diagram. So then we've got the neural groove here. The next step is the formation of the neural crests. These are shown in green in this diagram. These will eventually form much of the peripheral nervous system, whereas what's in the blue here will form the central nervous system. So the final step is the encapsulation of the neural tube, so it's completely closed off now. And this, as I said, forms the central nervous system. Okay. So as I said, that tube forms by week 4. It then starts to differentiate into the different parts of the central nervous system, with the brain forming rostrally and the spinal cord forming caudally. By week 6, both sides of we're starting to get that symmetry of the spinal cord, and it's actually starting to resemble what it will finally. So we can see, yeah, so we can see in this picture we're almost getting the start of that butterfly shape, with our motor neurons at the front here in red, and the sensory neurons at the back of the spinal cord, and also the formation of those dorsal root ganglion at the back here. And yeah, again, we've got these axons forming the white matter. So this is a pretty important process, but as you can see, it takes place in quite a short period of time. So we do have gender-specific areas appearing at these early stages, and this depends on the presence or absence of fetal testosterone. Maternal exposure to radiation, drugs, or infection can harm the developing central nervous system. So I think this is becoming more and more common knowledge that the things that a mother is exposed to even before conception can interrupt this process later on. So we're routinely screening females of childbearing age for rubella now, because it's important that women are vaccinated against this to prevent some of these central nervous system disorders. And obviously alcohol and opiates have a pretty big impact on the development of the central nervous system. The hypothalamus is one of the last areas of the central nervous system to develop. So babies born prematurely do have issues regulating their body temperature. Someone talking to me? Hello? Can you hear me? And the visual cortex develops slowly over the first 11 weeks.
Is that after birth or before?
After. Okay, some other developmental aspects of the central nervous system. This is obviously later. Age does cause some cognitive declines in the central nervous system, but this shouldn't be significant until the 80s. And the shrinkage of the brain accelerates as we get older. Interestingly, excessive alcohol use in boxing can cause signs of senility unrelated to the aging process. So this is, I guess, damage to the central nervous system that replicates the effects of aging, but is obviously not related. Okay, so when this process doesn't go right, we do have several conditions that can result. Cerebral palsy is I think it's due to brain damage and a lack of oxygen during birth. So complicated births can result in cerebral palsy. So we're getting better at this too, at monitoring babies during birth, so that we can try and prevent this lack of oxygen. There's different degrees of cerebral palsy too. Some people can live a relatively normal functioning life, and others become increasingly disabled throughout the duration of their life. Some patients have seizures, intellectual impairment, deafness. Most cerebral palsy individuals have issues walking, so they will often have walking aids. Going back a little bit earlier in development, anencephaly is where the cerebrum or parts of the brainstem never develop. So we can sort of diagnose this now at the 12-week scan. And basically there's no brain visible, and it's because the neural folds have failed to fuse. The child would be vegetative and most likely would die soon after birth. I think in many cases it's actually recommended that because of risk to the mother, that the baby is terminated. Spina bifida may be a little bit more well known. It's where there's incomplete formation of the vertebral arches. There's different levels of spina bifida. Spina bifida oculata is the least serious, but it's also the least common. And it involves only one or a few missing vertebrae. And then the more common one, spina bifida cystica, is more severe, and we have these sac-like cysts protruding from dorsally from the spine. We do know now that these three conditions, so both the spina bifidas and anencephaly, are caused by a lack of the B vitamin folic acid. So supplementation in at least the 3 months prior to conception has actually caused a drop in the rate of the occurrence of these conditions. If you've had a past case of anencephaly or spina bifida diagnosed, then often if you are trying to conceive, you'll be prescribed a really high dose of folic acid, so higher than what you can buy sort of from the vitamin shop. And this is in the hope that that would prevent that condition occurring again. So that brings us to the end of the lecture. I think I've covered everything. Again, there's a lot of detail in some of those neuronal pathways. But I guess for the take-home messages, that the structure of the spinal cord is really important, and remembering that the way in which our sensory messages and our motor messages travel throughout the spinal cord. I think that's probably the most important stuff to take home. Any questions?